What's the difference between conventional and functional treatment of cancer? There are several differences. For example, in conventional oncology, your doctor is focused on the tumor. He or she wants to use whatever tools have been demonstrated effective against your type of tumor with the objective of killing the tumor or removing it from your body. One of the problems with this approach is that killing the tumor also increases risk of killing the patient or doing other damage. My own 94-year-old aunt was actually quite healthy and working in her garden every day until she underwent conventional treatment of a breast cancer that at her age did not need to be treated at all. She died of heart failure, proven to be caused by the chemotherapy and radiation she was subjected to. We do want to get rid of the tumor, but we don't want to harm the patient who carries that tumor. Secondly, in functional oncology, we want to do everything we can to strengthen the immune system because no matter what we do, every treatment we have at our disposal can only reduce cancer cells. It cannot eliminate them completely. It's your immune system that has to do the final job and really needs to help us along the way. Unfortunately, surgery, chemotherapy, and radiation all damage and weaken the immune system. Now, each has their role, but we have to use them judiciously if they are the most appropriate approach to a given cancer. Next, in conventional oncology, as I said, the focus is on killing the tumor. But what about identifying and treating what caused the tumor in the first place? Now, if we were to rewind the clock and go back to the 1700s, most people did not know what the word cancer meant. This is because cancer was so rare in those days. Why is that? Because we didn't have the overwhelming number of toxins in our environment and our lifestyles as we do today. Some estimates put it easily above 88,000 man-made chemicals in our environment, in our daily use, that were never tested for safety in humans because there's no requirement for them to be tested for safety. Not even the food we eat is required to demonstrate that it does not lead to cancer or other diseases. I guess I should say food in air quotes because most of what we find on grocery store shelves is frankenfood. It's chemicals made in factories, not food harvested from the ground or animals that God gave us to eat. With that said, in functional oncology, we look at all the factors that have been demonstrated to lead to cancer and to specific types of cancers and help you address those factors, because even if your tumor is completely removed and even if you have no circulating tumor cells, you're not out of the woods. If you don't know why you got cancer in the first place, how do you know you're not going to get it again? And even if you've completely removed the organ or organs that grew the tumor in the first place, how do you know you're not going to get another organ? You have to address the causes at the same time. You're strengthening the immune system, enhancing your overall health and vitality, and killing tumor cells. In functional oncology, we do not treat cancer. We treat humans who have cancer, and we help them, their own bodies, kill the cancer. Now, this doesn't mean that you can't and shouldn't work with a conventional oncologist as well. It can be a team effort. This can depend on what kind of tumor you have and how extensive it is. Get as many brains on the caper as you can. You need all the help you can get. Don't limit yourself to one approach. But once you've been explained all of your options, you need to choose the approach that makes the most sense to you, that appears to be the safest while also the most effective for your specific needs.